I'm Dr. Tostado of the iBody, and we're located in San Marino, California. And I practice restorative medicine, and I'm board certified in restorative and anti-aging medicine, so that we can help people nutritionally and help detoxify the body, and also help people with weight loss and overall issues of energy and any other metabolic diseases that we can help them with. We do two very specific tests here to determine your genetic makeup and understand your body from a very specific physiological genetic perspective. One of them is a saliva test known as the pathway genetic fit test, and we also do blood testing known as subparticle blood testing to look at both blood genetics, inflammatory markers, and the blood fats that actually have an impact in terms of our overall health. Like you saw earlier in this video, our client taking the test themselves, now we have the actual results that we can just briefly go over to give you a better understanding as to this genetic testing, both from the blood and the DNA from the cells of our inner cheeks. And we get this printout, as you can see, titled Pathway Fit, Diet, Nutrition, and Exercise, since it looks at your genetics from these perspectives. In this particular client's case, we get to the summary page, and here we're looking at his diet, and we see that based on his genetics, his body has a tendency to have optimal health with lower carbohydrates and a more Mediterranean type of eating, meaning your good fats, your clean proteins, and plentiful vegetation. And we can see here briefly written other suggestions in terms of his eating habits based on his genetics. So again, the whole point is to optimize health and prevention of disease. It gets more specific in terms of even vitamins, fat-soluble vitamins, how his body does in terms of utilizing folate and B vitamins. Genetically, he has a tendency to have deficiencies. So that being known, now we can optimize his health by putting him on whole food-based supplements that will maintain his levels at normal. So food recommendations are also given for both folate and B vitamins, like green leafy vegetables, legumes, and certain whole grains. On the flip side, we get into exercise and metabolic health. And in exercise, it gives us a genetic marker whether someone benefits more from endurance type exercises, swimming, bicycling, walking, running, versus weight training. And in this particular client's genetic makeup, we see that aerobic exercise, running, swimming, jogging, hiking is of the utmost benefit for his genetic markers, because his genetic tendencies are to have higher cholesterol levels, low HDL, which is associated with the benefits of protecting our heart. And with exercise, we can increase HDL, particularly aerobic exercise. And markers are also showing that he has a tendency for insulin resistance, which can lead to diabetes, as well as high blood pressure. So now we have this general knowledge from his DNA cell perspective of nutrition, specific vitamin need, exercise tendencies for prevention of his metabolic tendencies of diabetes and high blood pressure, for potential heart and stroke. And the following pages simply give us a very detailed perspective of each genetic marker so that we know ways that we can assist ourselves in terms of creating a better health environment in eating, exercise, snacking. With this pathway saliva test, you're also issued a food plan which gives you your specific dietary needs to optimize your health And it gives it in various amounts of calories, 1,200, 1,500, all the way to 2,000, with specific meal plans for breakfast, lunch, and dinner, so that you can see very specifically the foods based on your genetic markers that are going to help assist you in terms of prevention of disease, optimizing energy, and optimizing overall health and vitality. So the other test that I was demonstrating earlier in this video was the blood test known as the subparticle blood testing, which we do here, and they focus also on blood genetics, which coincides with the Pathway Fit saliva DNA test, to give us a broader picture in terms of cholesterol levels, but of the types of fats that are critical to understand, and other genetic markers for our health and brain function and health overall. And this is an example of a subparticle blood test, which is color-coded, so it's very simple to interpret the results. Green is normal, yellow is moderately normal, red is high risk. And as an example, here on the upper half, these are standard blood tests that your doctor does with total cholesterols, LDL counts, HDL counts, triglycerides, and we're seeing essentially all normal. But the problem is that's where the story ends here, and you're now living your life thinking everything's normal in terms of your blood fats, when the reality is when we look at subparticles, we're seeing some red indicators that are actually dangerous for our health if we don't address these things. So things known as ApoB or LDL particles versus LDL counts, and small density LDL, which is even a more dangerous particle, and what is known as Lp(a), which is probably the most dangerous inflammatory particle in our body that can lead to strokes and heart attack, which tends to be hereditary, but we address these nutritionally and with our lifestyle, so that when we repeat these tests about every 3 to 4 months, we can ensure that we are going in the right direction with our subparticle blood testing. We get into inflammatory markers because it's actually inflammation in combination with these subparticles of fat that combine to cause heart disease. And inflammation is caused by all our exposure to toxins, whether it's hormones and antibiotics in our foods, heavy metals, mercury fillings from the dentist, cosmetics, pollution in the air and in the water. And with inflammation, it causes stickiness in our blood vessels, and this stickiness can attract the bad cholesterol particles to cause clotting of the arteries, leading to heart disease and strokes. So again, we focus on these markers so that we do either a detoxification process or teaching people how to eat cleaner foods, so that these cleaner foods help detoxify our bodies. And we get into some other genetic markers. Apolipoprotein E is key because it tells us whether or not we should be eating more Mediterranean, and this will coincide with the saliva pathway test. Are we ApoE type 4, which means that we can be more prone to Alzheimer's disease, especially if we're diabetic, and we should not be drinking alcohol in any kind of excess when we fall in this category, because our livers do not process alcohol well genetically in this category. We look at other blood coagulation factors to see if we need supplementation to optimize your body's detoxification process at the level of the liver. We're looking at blood sugars, insulin levels, very specifically vitamin D levels. A lot of over-the-counter and prescription vitamin D aren't processed in our bodies correctly because they're synthetic. So we ensure that you get on a whole food-based vitamin D so that your body absorbs vitamin D to help prevent cancers, osteoporosis, and neurological disease. A very important marker that we look at is homocysteine, because elevated homocysteines can lead to Alzheimer's disease and heart disease and other neurological disorders and cancers. And homocysteines increase with exposures to toxins, smoking, if someone has chronic illness. So homocysteine is something we can actually help decrease through whole food nutrition and nutritional supplements. Then we get into some sterol testing. Sterols are fats, and whether genetically our body has a tendency to overabsorb fat or overproduce fat at the level of the liver, so that we can give the nutritional supplementation that's going to help decrease either fat absorption or production of fat in our livers. It gets into some standard blood tests, but of all these, one that isn't standard is what's known as T3. And I always check T3 because TSH and T4, which is typically tested for thyroid function, come back normal, and yet you're not going to feel great many times. So I go a step much further and check what's known as T3, which is the actual active hormone in our bodies. And if T3 is low, even below normal, and your body temperature tends to be on the low side, or you feel cold at night, you have to wear an extra sweater, whatever the case might be, chances are you have what's known as Wilson's temperature syndrome, and we treat that with T3 very specifically for 4 weeks, and many times that takes care of the problem. And you start feeling much more vitality and health and increased metabolism, and no longer feel cold chills or anxiety for that matter. Check for anemia, and the last critical particle that we check for in the subparticle blood testing is our omega-3 index, which typically should be above 8, and it gives us a list of the seafoods, the fish, and other foods that have the highest essential fatty acid content, known as EPA and DHA, which help protect our heart, stabilize our blood fats, and encourage people to take a very purified fish oil so that we can maintain our omega-3 levels higher to protect our heart, our brain, and it works also as an antioxidant to help prevent toxic buildup in our bodies. So the combination then of subparticle blood testing, pathway genetic saliva testing gives us a very powerful insight into the physiology of our clients, so that we can make more intelligent decisions in terms of their nutritional needs, their supplemental needs, their exercise habits, all for the prevention of disease and to promote health, healing, energy, and vitality. Thank you.